In vitro fertilization is a difficult and time-consuming procedure, and having no positive outcome at the end can be pretty demoralizing for a woman. Many people worry if it's worth the bother to go through the operation again because of the emotional distress and the costs. In this case, it appears that trying to conceive naturally is the superior alternative. But after a failed IVF cycle, is it still a possibility, or should you look into other options? Watch this video till the end to find out. Subscribe our channel to stay updated on all information related to IVF. Click the bell icon to get notified each time we upload a new video. Is it possible to have a natural pregnancy after an IVF failure? Many women mistakenly believe that opting for IVF to create a child means they aren't fertile enough to conceive naturally. Infertility is caused by a variety of circumstances. Thus, this isn't always the case. The relationship between fertility and the ability to have a child is complex, involving everything from a sperm quality to egg availability, viability, and a variety of health factors. Even if your odds of getting pregnant spontaneously are lower than those of other people, they are far from zero. And natural pregnancy is possible even if your IVF attempts have failed. What are the chances of getting pregnant after failing one IVF cycle? Failure at the end of your first IVF process, as frustrating and disheartening as it may be, it is not the end of the road for you. A single failure does not imply that every subsequent cycle will also fail. The body may require some time to adjust to the surgery and may respond favorably the second time. At the second attempt, several women have seen healthier embryos and a better bodily response, resulting in a successful pregnancy. These odds are bolstered by solid statistics and statistical information gathered throughout time. A woman's chances of becoming pregnant after her first IVF round are about 21%. However, what appears to begin at a lower level improves over time in subsequent cycles. The chances of getting pregnant grow by 10% after the second attempt, with the fifth cycle obtaining a nearly 40% success rate. However, any attempts after the fifth scarcely improve the situation, and it is preferably to consider other options for having a kid at that time. After a failed IVF round, is natural pregnancy possible? This is easy to comprehend when you consider the many ways women have gotten pregnant over the years. Several women have pregnant naturally on their first try, while others have conceived in the first cycle of IVF, and a few have conceived in subsequent cycles as well. The woman's body is extremely important throughout the treatment. Infertility might have a variety of causes that aren't always obvious. Following an IVF process, the body begins to respond positively, and the woman becomes more aware of those symptoms, perhaps increasing the chances of conception. The chances of IVF success in the first attempt are lower in women who have uterine difficulties, mostly due to the presence of a weak or thin outer lining of the uterus itself. The surgery, on the other hand, may encourage the body to create a stronger uterine lining in the months ahead. Attempting to conceive naturally may yield positive results, and a second IVF treatment may not be necessary. There is no conclusive element that can be identified with certainty as the one responsible for reversing the odds of becoming pregnant. The continual attempt to become pregnant naturally is nevertheless the most common factor in all the situations. Couples who only attempt once in a while are less likely to see beneficial results. In comparison, those who have intercourse frequently and regularly with a desire to become pregnant have a better chance of getting pregnant even after a failed IVF effort. How to increase your chances of getting pregnant after an IVF failure? Your habits, behavioral patterns, and lifestyle choices all play a factor in whether or not your pregnancy is successful. IVF makes use of the body's inherent processes and encourages them to function at their best. If a woman smokes while trying to conceive, her odds of becoming pregnant are practically halved in one fell swoop. Caffeinated beverages are also known to reduce the odds of pregnancy when consumed on a regular basis. Alcohol and fat have a negative impact on the capacity to carry a pregnancy to term. It's vital to remember that IVF is a medical treatment, not a magic wand that can magically produce a pregnancy. Changing specific lifestyle choices, exercising regularly, and eating a balanced diet are just as important throughout an IVF process as they are while trying to conceive naturally. As a result, it is safe to conclude that there is some good news for women who are wondering if they can conceive spontaneously after failing IVF procedures. Maintain a calm demeanor, concentrate on your health, and give it your all as often as possible. Need help in getting pregnant? Please send us your medical details by filling in the form at www.drmalpani.com/free-second-opinion so that we can guide you. And don't forget to subscribe our channel to stay updated on all information related to IVF. Click the bell icon to get notified each time we upload a new video.